Chronic diseases like type 2 diabetes, heart disease, and obesity are often framed as personal failures of willpower or poor lifestyle choices. But beneath the surface of individual behaviors lies a deeper, structural reality. Access to healthy food is not distributed equally. In fact, where a person lives, how much they earn, and what they've been taught about food often determine their risk for diet-related illness far more than personal discipline ever could. The burden of chronic disease in many communities is not just about diet, it's about inequity. In low-income neighborhoods, especially in both urban and rural areas, access to fresh fruits, vegetables, and whole foods is often limited or prohibitively expensive. These food deserts are areas where convenience stores, fast food restaurants, and liquor shops are more common than grocery stores with produce aisles. Even when supermarkets exist, they may carry fewer healthy options or price them well out of reach for families on tight budgets. As a result, heavily processed, calorie-dense foods become not only the most accessible but often the most affordable way to eat, regardless of the long-term health cost. Income inequality plays a central role. A family living on minimum wage or under the poverty line often can't afford to prioritize nutrition when rent, electricity, and basic survival come first. Packaged snacks, sweetened cereals, and fast food may be the only viable options after a long workday, especially in households with multiple jobs or limited kitchen access. This economic reality pushes individuals toward choices that increase chronic disease risk, not because they don't care about health, but because they don't have the means to do otherwise. Education is another critical factor. Nutritional literacy is unevenly distributed across socioeconomic lines. People in disadvantaged communities may not receive accurate or culturally relevant health education, leaving them vulnerable to marketing tactics, misinformation, or confusion about food labels. Some may not know how to read ingredient lists, navigate deceptive health claims, or cook fresh meals from scratch because those skills were never taught or modeled. Without clear, accessible, and actionable information, even the presence of healthy foods doesn't ensure they'll be used effectively. This intersection of poverty, lack of access, and low nutrition literacy creates a feedback loop. Communities most at risk for diet-related diseases are often the least empowered to prevent them. The consequences are measurable and devastating. Studies consistently show that rates of obesity, diabetes, hypertension, and cardiovascular disease are significantly higher in low-income and marginalized populations. These same populations often face greater barriers to healthcare access, compounding the problem. Addressing this isn't just about individual choice or telling people to eat better. It's about creating environments that make healthy choices possible through better urban planning, living wages, school meal programs, subsidies for fresh produce, culturally relevant education, and healthcare systems that screen for food insecurity. Policies like sugar-sweetened beverage taxes and nutrition labeling requirements are helpful, but without parallel efforts to ensure that every family can afford and understand healthier alternatives, the benefits will remain uneven. This is where food justice meets public health. The goal isn't just to lower the national diabetes rate, it's to ensure that no one is more likely to suffer from chronic disease simply because of where they were born or how much money they make. Real change means shifting the conversation from what are people eating to what are people being given access to eat and why. Ultimately, reducing the burden of chronic disease means dismantling the structural barriers that shape food environments. Personal choice matters, but choice is only meaningful when all options are truly available. Until then, efforts to promote healthier eating will fall short, not because people aren't listening, but because they're being asked to do the impossible.